Living with a bleeding disorder is challenging for anyone. One of the most amazing things is in the last 20 years, we've had incredible advancements in therapy that are safe and are able to give us a long life as long as we have access to those medical treatments. My name is Jonathan James with Hope Charities, and I'm excited to talk to you a little bit about an event that we have coming up right around the corner on February 18th and 19th to talk about emerging therapies. There is a pipeline full of new medications that are coming out that are being tested and trialed right now to understand a little bit more about how to even improve the therapies that we have today. And I'm excited to talk about those things. We've got some amazing sessions lined up to talk about what's in trial now, what's coming out that's just on the brink of being released, and also some of the things that we've experienced throughout our history. And one of the things that I wanted to dive deep into is to talk a little bit more about how does it feel to participate in a drug trial program? These things are very seasonal. It's kind of dependent upon what's coming around the corner. But if you've ever been in the clinic setting and you've been invited to participate in a trial, what is that like? What does it feel like? Is it nervous? Is it difficult? Is it heavy? And so these are some of the things that we want to talk about at our event coming up. You can go on our website and register for this event right now. It's a free event. We're going to have lots of giveaways and prizes and fun time and lots of community and connection points. It's going to be a blast. But today I've invited a friend of mine to join me to talk a little bit more about the drug trial process. Lisa Swaney, it is great to see you. Thank you so much for joining me today for the Hope Podcast.
Well, thank you. It's great to be here.
I am excited to have this conversation because you and your family have been a part of drug trials in the past. And this is an area that I feel like that so many people, there's a lot of mystery involved. There's kind of a veil and you have to pull behind the curtain to see a little bit more about what goes on behind the scenes. And it's an opportunity sometimes that we're not always given, depending upon your circumstances. But sometimes when the right moment comes along, it's an interesting thing to participate in. So excited to talk about that with you today, but I'd love to learn a little bit more about you for those who are listening and don't know you as well as I do. Tell us a little bit about where you're from and how you're affected by a bleeding disorder.
Alrighty. So, like Jonathan said, I'm Lisa Swaney, and I live in a little town, Oxford, Indiana. Um, I am affected. I have hemophilia, and so does my son. Um, and that's kind of how we're apart today.
How you're affected. So I have a question about that. So did you know early on that hemophilia ran in your family, or when Zachary was born, was that a new diagnosis or was it a surprise?
Yeah. So when Zachary was born, he was born with two conditions: cranial cystinosis and also cleft lip and palate. So he had a major surgery to reconstruct his whole head at 3 months old.
Wow.
And during that, we almost lost him. And that was literally when we found out that he had hemophilia. Um,
Wow.
my father passed away when I was 8, so I never got that back history and things like that. So even though the hemophilia center in Indiana knew our family had it, we did not know it until he had that surgery. So yeah,
Wow.
it was like a new thing for us, and it definitely changed our world. So
Wow. 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 It's amazing is that sometimes you don't even know where to turn or who to go to, but the fact that you had a record even at the treatment center that was starting to be able to at least give you a foundation was helpful. Just out of curiosity, was there suspicions that your father passed away because of bleeding, or was it unrelated?
yeah, I mean, it was a factor to it. There was a
Mhm.
lot more to his passing, but
Mhm.
it definitely I would say like quickened it, I guess, if you want to
Yeah,
say that.
sure, of course. Yeah.
So
Well, I'm
yeah.
so sorry.
Yeah, thank you.
I one of the things that's really amazing is that, you know, all of the technology that we have today and in the world, there's still so many people that don't survive really early stages of life. We still hear people that are, passing away, at birth from circumcision and things like that didn't know that they had a bleeding disorder. And so this is one of the things that's so important about sharing your story and getting this message out there so that
Yeah.
people can learn as much as possible. And so I really appreciate your courage to be able to share your story today because it is so impactful to people out there that have maybe suspicions but don't know for sure. And so it's amazing. Let's talk a little bit about the journey of your son growing up with hemophilia, and you've got some challenges, you've got some treatment going on. But at a certain point, you're involved with the treatment center, and they approach you with this opportunity to participate in a drug trial program. Tell me a little bit about how that came about.
Yeah. So Zachary is actually getting ready to have his 18th surgery.
Wow.
And so he has been, and I mean, it's just been like one after another. I feel like he's had maybe a 2 year stretch where he's had like nothing done,
Mm,
thankfully. So that's been a blessing to him. But he's involved in sports. He likes basketball. He likes baseball. He enjoys I think his biggest thing is weights. He just loves to do
wow.
weights and work out with his boys. And but during all of that, he does acquire several injuries. And I
Mhm,
mean, it's part of the game, but I also feel like, well, a couple in the baseball ones that he's had, I felt like it was a lack of paying attention.
mhm,
And it just happened, but we dealt with it. But Zachary, he's a very, very hard stick. And
mm,
we've struggled with that like since birth. I remember them in the hospital. They had to do it in his like head or in his feet. Like those were like the best veins they could get from him because he just didn't have him in his arms.
mhm,
Um, and so that's just been he's always struggled with that. And so
mhm,
the medicine that he was on wasn't really quite working or meeting the needs that was best for him. So
mhm,
it was a couple of years ago. He had a major injury with baseball, and he was out for several weeks. And that was when we were approached with um, participating in a trial for a substitute drug. Um, and we went in and we met with his doctor and we went over what it was, what the risks were, like what were the benefits, and like the process of the trial with them. And Zach was like, "Yeah, let's do it. I mean, it's a whole lot better than being sick all the time."
yeah,
and and so we did that, and we just finished a trial in January, and we're still on it, and it's working for him, and things are
that's
going
awesome.
pretty good.
That's awesome. Well, I'm really excited to hear about his journey. One of the things I think is super important that a lot of people don't realize is that this is really a quality of life thing, right? You can go from literally not having any quality of life to all of a sudden it being really life changing, and I think that the IV infusion has been a big hurdle for our community for many years. It's been created a lot of trauma in some cases, a lot of
Yeah.
difficulties. I'm directly affected, as a lot of people know, and I have many memories of, being held down and stuck, over and over and over again, trying to get a vein. And I was a very hard stick as a child, so I can relate to that in Zachary's story for sure. So when you hear about this opportunity, about this trial program, I mean, what was your first thoughts? I mean, here's Mama Bear. Like, are you nervous? Are
Yeah.
you like, not sure? I mean, how did you even talk to him about it? Was he there when did you both hear about it at the same time? Like, how did those things occur?
Yeah. Well, his doctor called me about it first. I mean, I've been advocating for him to switch drugs for a while. I felt
Okay.
like I was like, this is just not working. And then just like what you said, Jonathan, like the trauma. I mean,
Hmm.
Zachary was being on like wrapped to the table. And
Hmm.
I mean, there were many times that I personally couldn't handle it as a mom, and I had to step out of the room while they did what they had to do to him because it was so
Hmm.
traumatizing for him and myself.
Hmm.
Um, so eh, the fact that she called me and she was just like, there's this trial, and I really think Zach would benefit from it. And she was like, "Do you mind just bringing him in and having a conversation?" I'm like, "Absolutely." So I talked to Zach about it, and we went in, and he was open, and he was like, "So I'm not have to get poked all the time." She was like, "It's just like being a diabetic, and
Wow.
explaining that and how it was a lot smaller needle, and he was
Hmm.
all for that. So
Wow.
he had a lot of questions, and the process of that, we had to go back. I think it was initially we had to go back every 8 weeks, and then once we hit the year mark, it was every like 3 to 4 months we went back,
Hmm.
and
Hmm.
he had to do like these tests, like a written test that he had to do. It's more like mental health, checking in mental health wise, and
Hmm.
how is it affecting you overall and the quality of life. And Then we had to do lab works, and then ultrasounds on his joints.
Mhm.
And that he'll still continue that every 6 months with this drug. So
Wow.
it's something that he's used to doing now, and he's fine with it.
Yeah. Well, so walk me through the initial part of the process. There's probably a good bit of paperwork you had to fill out and all of that.
Yeah.
And so then you start the program at some point and I mean, you gotta be thinking a little bit about, like, the hope that this could potentially work. I mean, was there a sense of, like, really excitement and anticipation as well for you and Zachary?
Yes, I definitely think there was. I mean, when Zachary was able to like kind of process what everything the doctor was saying to him about this and
Mhm.
like the benefits it would be for him, just he was more he was more hopeful of the less pokes. That was
Mhm.
his thing. It was like, if I don't have to be doing this, and then I mean it'd be better for me. But
Mhm.
for me, it was more like this is more manageable treatment for him.
Mhm.
And that
Mhm.
was what my process was as a parent, was like, I can, this is something that we can manage. Like, I don't have to fight him every time he gets an injury and has to like infuse through an IV, or we have to go to the hospital. Um,
Mhm.
so those are things that I was looking for and being hopeful for this during
Yeah.
this.
And one of the things I think people don't always understand is that you have this whole team of clinicians that are sort of like available at any moment's notice to be able to call and ask questions. Did you feel
Yeah.
comfortable knowing that there was like a lot of attention also being given to you through this process so that you knew that you could just pick up a phone and call an expert if you needed to?
Yeah, absolutely. I mean, there was, I mean, a lot more. I felt like we had a lot more support during the trial than we did when we were not on the trial. There were a lot
Yeah.
more hands involved.
Yeah.
And knowing that, and they would follow up with us too, like even in between our appointments, they would follow up with us. We now got Zachary, so we use an app at our center where we communicate. So now Zachary can communicate directly with him.
Oh, that's awesome.
And so that is because he's a teen. And so I want to hand him that responsibility, and I can still see what he's saying.
Yeah.
Which it's them communicating with him directly about like, especially when he's had additional injuries or things like that. Because
Hmm.
all that has to be documented and logged through the trial.
Hmm.
Um, so
I
it's
love
definitely
that.
been good for him in this transition period. So, which has been
Yeah.
challenging in general.
So, yeah, it is for everyone, and I don't have any secret sauce, I wish I did, but, I was a teenager once and I wasn't the most responsible and, I took a small army to help get me into the rhythms that I'm into today for sure, but, tell me a little bit about in this trial process, he starts to become aware that this medication is providing him coverage and he's very active. Of course, were there other surgeries going on? I don't know if there was other things
Yeah.
happening, but tell me a little bit about, like, when you started to realize this is working, like, in the trial program, was that a revelation to him and to you?
Yes. So it took him a little bit longer to realize it was working. He just thought it was like something else. But the even like the little injuries that he got, he didn't have to
Mhm,
be infused with his other medicine, right? Like, so
mhm,
that was the bear,
mhm.
that was like a wall of protection, and he didn't see that until I'm like, yes, you have an injury, we're gonna ice it and rest it, and they're telling us like we don't have to infuse you, like, so
Wow,
it's telling you it's working, like,
wow.
except for like the major ones where
Sure.
he got hit in the head. I mean, that was like hospital visit,
Yeah,
but
right.
um but yeah, he's realized that. It took him a little longer. I mean, he's a
Yeah,
stubborn teenager too, so who thinks he knows
yeah.
everything?
That's right. Well, hey, we all have to learn somehow. That's awesome.
That's right.
So you go through this trial, and at a certain point, you get close to the end of it. It's working well, and I mean, you know, did you feel like that? Well, I mean, I think a lot of people would be wanting to know, like, did you stay on the medication after the trial was over?
We did. Yes, so that was an
Mhm.
option. We could either not do it or continue it. That
Yeah,
was a discussion with Zachary. Like I let him actually make that decision.
smart.
Because the way I look at it is that eventually, like, he needs to start taking the reins of his own health, you know,
Mhm,
and
mhm.
it was a discussion. I mean, he was back and forth, and he just thought he was just. But the other thing of it was like, if you don't do this, then you're going to go back to doing your injection weekly. So it's either this or the other one, and so
Yeah,
he chose this one because it's easier. You know,
yeah,
it's better to maintain, and he knows it. It's just, um, I mean, in the world that we live in, honestly, he probably wouldn't want any of it. But unfortunately, that's not the
yeah,
circumstances that he was dealt with. So he
yeah.
knows.
Did he feel like that through the process that it was successful for him to try this process in the trial? I mean, does he feel a little bit more confident and capable, and does he feel like he can own it now in a different way than he was able to before?
Yeah, I believe he does.
Yeah.
I believe that he has looked at it because every 3 months he's had to redo this questionnaire thing. And I'd
Mm.
asked for like copy because I didn't get to see it like
Oh.
throughout the process. So I was curious on what he would choose for himself and like
Mhm,
overall, like how did he view his mental health and everything else with this. And
mhm.
so they were able to give me all the results at the end of it. And it was just as a parent to see from his perspective, because he's not going to just tell me, right?
Right.
He- to see how he viewed this treatment from his perspective was very eye opener. I was like, we did a good job by choosing this and
Yeah,
doing this for
yeah,
him.
yeah.
It made me feel good as a parent. So
I bet. I bet. That's so sweet. I love that. There's so many things that you just so many unknowns that you're not sure how to navigate, but it is wonderful when you're able to see that, and look, I've got 4 kids and all of them are teenagers. Well, my oldest
mhm.
is an adult, but my younger 3 are teenagers and they don't wanna tell me anything. I'm like, "Dude, just speak up," but, it's been an interesting road, and so how to decrypt, the little, eye twitches and the, like, small little phrases that you get here and there, sometimes it's a skill that all parents have to learn, but
Yeah,
it's gotta be fulfilling from your point of view just to know that your child is healthy and whole, but also that he's feeling that independence as well.
yeah.
That's so good. I guess, one question I think a lot of people want to know is when considering a trial program, or maybe they're thinking about the future of new medications and things like that. I guess, the big question is, would you do it again? If you had to do it all over again, would you do the same thing again?
I think that would be with my son at his age. I would leave that. We would have a really good deep discussion, but I would leave that up to him.
Yeah.
If I had a younger kid that was doing it, I would have to know more detail. I mean, I enjoyed it. The wealth
Yeah.
of knowledge, and the communities that surrounded us, and meeting. Like for me, I love to meet new families. I love to talk to different people. I love to hear their experiences, and that's what
Mhm.
I love going to all these different events and just
Mhm.
developing that sense of community. And
Yeah.
that's like what I get out of it. And I love to be able to share like this is what worked for us and what didn't work for us. Um, I did during this process, my sister, who her son has hemophilia as well. I ended up getting him on the trial too.
Oh, wow.
I know,
That's
because
awesome.
he saw also the benefits that Zachary was having from it, and he didn't
Yeah.
have to get like poked weekly. And I mean,
Yeah.
he was like, "I'm gonna try it," and he's still on the trial because he started
Okay.
after we did. But I
Yeah.
mean, he likes it too. I mean,
That's
if
awesome.
I would just say go for it, to be honest. Go
Yeah.
for it and see what it works for you. You can always quit. You don't have to do whatever, but it's what works for you and your family.
That's so good. That's so
Yeah.
good, Lisa. Is there anything that you learned in the process of doing the whole trial thing that, was really valuable that you wish that maybe other people knew about before you started? Maybe you wish you knew about before you started the process?
I would say the one thing would be to never give up advocating for yourself and for your kids. I felt like
So
through this
good.
process, if for instance, if my son wouldn't have gotten a major injury, would we even been offered this? Do you know what I
Mm,
mean? Like I feel
mhm.
like um I have like advocated for a while for my kid to like try different things and do different things, and I feel like I have not been listened to.
Mm,
So as a parent, I would just, if you feel like it's right and you talk to other people about it, and even like the drug manufacturer people, and they give you all this evidence and all this facts about it, and you feel like this is going to be best for your family, advocate it. Like, say, this is what I
yeah,
need, this is what we want.
so good. That's so good, Lisa. And I think it's so underestimated and undervalued too of how much the patient voice really matters in these decision making. I'm a big fan of shared decision making. I think that there's something with the sanctity of the the clinical and the experience that comes from the patient experience as well, being shared decision making. But in that, it's got to be 50-50. Like, you've got to have a voice in the middle of it. And I'm sure most people have experienced, like I do, white coat syndrome, when you walk into the clinic visit and your blood pressure goes up and you're not sure if you can ask questions or say things. But it's so important to make certain that you share your voice in those moments, and like you said, advocate for your child. You know your child better than anyone will ever know your child. And it's so important that you speak up and share those things. And that's why we do what we do, right? That's why you go to events, that's why you share your story, that's why you have moments like this, just to be able to really help encourage others to really speak up. Because I think it's so critical that we sometimes underestimate the value of our experience. But the clinicians are vital as well. We need them to be able to share the data and be able to make a case to insurance and all those things. But if it wasn't for the lived experience, I don't think that the equation is not whole. And so really amazing to hear the journey and the process of that. I guess if anybody was had the opportunity to go through this process, I think you highlighted a really good point, is that it's a very personal decision. It's really got to be between you and your child, and the everyone's set of circumstances is very unique. And so it's really important to be able to consider those things well, and to make your choices accordingly. But thank you so much for your courage and for your willingness to be able to share your story today. I think it's speaks a lot of you as an advocate and a mama for your son, which will never stop. You will
Yeah.
always be an advocate for him. I'm 46 now, and my mama still advocates for me, and I need her to. And so thank you so much for all the lack of words and encouragement you get from Zach. I'm sure he probably feels it in his heart, but I'm going to give it to you now ahead of time. Just thank you for advocating for him, because I'm certain
Thank
one day he will be like me and turn around and give you all the accolades you deserve. But thank you so much, really and truly, for sharing your story and being courageous to do that. And then also
you.
just going through the vulnerability of having to help him through the journey, because it's so needed.
Yes, thank you.
Well, I'm excited about this February 18th and 19th event. I know you've actually been to a lot of these online events. You've been to a lot of in-person events and online events. You have any encouragement for anybody out there watching this, thinking, "Man, should I go? Should I not go? I don't know. Should I participate?" Any thoughts about that?
Just go. It's exciting to hear from different speakers and to learn from their experiences. Even online, like they get everybody involved and they want feedback and they want you to chat or speak. I I'm working when I do it, and I just listen to it while I'm at work, and just it. I love it. So just do it.
That's awesome. Well, I appreciate that, and we love it. I mean, honestly, in so many ways, a lot of us started doing online education in this format because of the global pandemic that happened a number of years ago, and we really couldn't be in person, and it really broadened our horizons to the idea that we could learn a lot, like you said, just at work, with having it playing in the background, listening to the podcast, almost in a way. It really does give you a lot of good information. But we really love these moments, because it is a way. I mean, you can't go to 16 events a year anyway. So, but to be able to kind of connect with the people, you get to know people.
Yeah.
We've gotten to know you. You've gotten to know
Yeah.
us. There's lots of people that kind of rally around these things. And I have to say, learning from other people is probably the best way to learn, don't you think?
Absolutely.
Yeah.
Absolutely.
So good. So, I guess, according to Lisa, go register right now for Emerging Therapies because it's a good
Go
opportunity.
do it.
Anyway, awesome, Lisa. Thank you so much for being here today, and I look forward to seeing you at the next one. But I really appreciate your courage and your willingness to share your story because I'm sure it's helped a lot of people. And if you have any comments or questions for Lisa, feel free to make those comments down in the chat below, and we'll make certain that she sees them and can respond accordingly. But thanks again, Lisa, for seeing you today, and we'll